You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. Whether you are missing one tooth, a few teeth, and especially, according to my first guest, especially if you have a loose-fitting denture. My first guest is an expert on the topic, periodontist Dr. George Duello. Dr. Duello, welcome to the program.
Randy, thanks for having me back.
Now, we've had you on here 3 times, okay? People always want you back. They think you've got a lot of things to say. You're referred to as America's dental implant doctor. Okay, so you do a lot of these.
Yes, what we do a lot of in our office, and we're very happy to help a lot of people.
Now, you have one of the busiest, I guess, dental implant centers in America. Is that correct?
Yes, we do. We're very busy helping all kinds of people, whether they've lost one tooth or a few, or they're about ready to lose their teeth, or they've lost their teeth. We're helping those kind of patients.
Do you think this is the future of dentistry, where there will be no more dentures?
Yes, I do. I don't think the World Health Organization, Randy, defines total edentalism, or missing all of your teeth, as a disability.
Okay.
And it's not only a problem in my town, St. Louis, but it's a problem all over the world. So I believe that we should eliminate the necessity for patients to have dentures that come out, they put in a jar at the end of the day and sleep without teeth.
You even have a special website that talks about that, because people, I guess, do.
I just don't think dentures should be removable.
Okay, now your practice, for people that don't know you, a periodontist, who's your typical patient? I mean, what are the procedures you do? I mean, do you do just dental implants, or you do a lot of other things?
We do. I'm a periodontist originally, so we do help people take care of their gums and make sure they're healthy. And if patients lose their teeth, Randy, they don't have to wear dentures anymore. So first thing I do is try to save their teeth, do preventive medicine and preventive dentistry to help you save your teeth. But if you do, for whatever reason, maybe it's genetics, maybe it's previous oral health problems, tooth decay, gum disease, maybe you're in a car accident. We have people who, we have a lot of people that ride ATVs, and they go over the front of the ATV and they break their teeth and they lose teeth. So we have patients with traumatic injuries. So it's multiple reasons that people lose their teeth.
What are the age ranges of people coming in for dental implants? The denture wearers specifically.
Denture wearers, typical 45 to 65 is when
45-year-olds are wearing dentures? Is that right?
Unfortunately, it is, Randy. And to give you an example, I grew up in St. Louis, and some people may remember in 1904 the World's Fair was held in St. Louis. And at that time, 1 out of 5 people lived to the age of 50. Today, because of modern advances in medicine, 4 out of 5 people are alive at 50. So today we consider those people to be young in that sense. And so it would be unfortunate, or I would feel very hurt if I lost my teeth at 45. And those are the people that we deal with the psychological ramifications of losing their teeth at a young age. I mean, if you're 80, I think sometimes people expect it, that you're going to lose your teeth. But
are 80-year-olds doing this?
Oh, yeah.
Really?
We've had up to 94-year-olds do.
Why would a 94-year-old want to do this?
Well, they want to do it because they want to eat better. They want to eat. Even 90-year-olds want to stay young today, because that's the 40-year-old of 1904. They want to stay young. And there's a lot of things that we can do in dentistry and in medicine to help those people maintain a normal lifestyle at 90. What people don't want in their older years is to have a disability. And it's considered to be a disability.
Come in and out.
I think it's a disability.
You do? Okay.
I mean, today, unfortunately, when people get injured, we have wars going on, they lose their leg, we're able to rehabilitate them so they can have normal function. They can run, they can be in Olympics, and they can do golf and normal things. Well, denture patients can't do those things. They can't eat, they can't smile, they're not confident. They want to speak without something rattling around in their mouth.
This is your passion, by the way, isn't it?
Absolutely.
We're at lunch. We should mention this. We're at lunch. You're showing me a PowerPoint. And it's a PowerPoint about teaching other dentists about this teeth in a day concept, all on 4, about getting denture wearers into a fixed set of teeth. So I said, well, what's your goal here? You know?
Well,
I loved your response, by the way.
Yeah, my goal is to really help these people who are suffering. And they don't have to suffer anymore. We have the technology, it's out there. I find that the patients, once they're informed properly and given a thorough examination, they get it right away. Unfortunately, it's my colleagues who don't get these concepts because they're stuck in paradigms.
The word's getting out, though, for sure. I mean, you spend most of your time, not most of your time, but you're on the road, isn't that right? I mean, teaching other dentists, we should mention that.
Yes.
Internationally, teaching dental implants to doctors.
I have a great relationship with one of the leading implant companies in the world, and I am given the opportunity to have the pulpit, to preach the message that it's not necessary. My grandmother lived till she was 96. I didn't realize until I was an adult she didn't have teeth. Unfortunately, she had so been wearing teeth for so long that we couldn't put implants in her. And I still live with that visual of my grandmother not having good teeth to eat with. I loved her. My grandfather was a dentist, so I wish I would have been able to serve my grandmother.
You know, it seems very painful. You made me go to your website and on YouTube, and these patients all say pretty much the same thing. It didn't hurt, or it was much. I'm paraphrasing, but that it wasn't what they expected. That it was easy, as a matter of fact.
It should be.
A piece of cake, one person said.
If it's done properly.
Sounds like an exaggeration. I mean, really, it's not pain, it's not a big deal?
It sounds like an overstated, egotistical statement, but the truth is that if it's managed properly, they don't have much discomfort. And here's why. When you hook the implant to the denture, nothing rests on the gum anymore. So it's not rubbing, it's not irritating, and so it's completely off the tissue.
And the bone doesn't have any feeling.
The bone really doesn't have any feeling. And so as long as you manage that properly and make sure the patient, well, we give them medication, they come back and say, I didn't take any of the medication. So really? I say, well, save it for a stub toe or something.
Okay, you've written a book, by the way. We should mention we're here with Dr. George Duello, and if you're missing one tooth, and especially if you have a loose-fitting denture, he has a whole YouTube channel with patient after patient after patient talking about this. Okay, change your smile, change your life. Now, of course you're a dentist, you think the smile is important. How important is it, as you see it? And who's this book? Who should read this book?
Well, I have... The title is Change Your Smile, Change Your Life. That's what I've actually seen. I've seen people who have been rehabilitated in dentistry, whether it's cosmetic dentistry or implant dentistry, who psychologically have undergone a transformation because I've had patients say, I'd rather have bad teeth than a good denture.
Really?
That's a horrible statement for a patient to make.
Interesting.
And so they go around looking bad.
This is because they don't want a denture so bad, they'll have horrible teeth in their mouth.
Yes.
Or ones that are hanging.
Because they're afraid of the pain.
Interesting.
They're afraid of the cost. They're afraid of what they might have to go through. And really, the truth of the matter is, today with immediate loading and computer...
What does that mean? What does that mean?
Well, you can come in, and you can be missing your teeth or about ready to lose them for whatever reason, disease, and we can take the teeth out, put the implants in, and give you something on the implants. So
teeth in a day can happen.
Yes, and here's my promise to patients. Here's the first concern they have, and the first question: am I going to have to go to work without my front tooth? Am I going to have to go to my bridge party, my supper club without teeth? And I say, my promise to you, Mrs. Jones, is at no point during your treatment are you ever going to be without teeth. And as soon as I see that relax come over their face, they're like, oh my God, all I was worried about is running around without teeth, and you're telling me I don't have to do that. And they just kind of calm down. Pain is an issue, but I really find that's really a smokescreen. What people don't, they don't want to walk around without their pants, they don't want to walk around with shoes.
Yeah.
So that's what we can do today. In the old days, that's not the way it was done, but with modern technology.
Yeah, help me understand that. Okay, so why is it what used to take you guys 9 months or a year for dental implants now can happen in a visit or two? What's going on?
The understanding of the biology of how it works is better. An example I give patients: if you break your leg, today many physicians put you in a walking cast. You don't have to be disabled and sit in a chair. So today, with dental implants, it's kind of like a walking cast. You can't chew exactly like you will when eventually the implants have healed, but at least you're not going without the teeth. It's not rubbing. It's not making soreness. You're not embarrassed because something has to come out. If you've had fixed teeth, it's difficult to understand taking something out and putting it on a counter. For a patient who's worn a denture, that's not as difficult. But for a patient who says, I've had teeth, now I don't have teeth, that's a real psychological challenge.
Now, in St. Louis, would you say tens of thousands of people either have an upper or lower denture?
At least.
Okay. Now, if it's so good, okay, and you say, I guess just 2 dental implants could give somebody something that could be very secure in their mouth. Why aren't they all doing it? What's your take?
My take is that, one, we as a profession haven't done a good enough job in educating, and that's my first mission and purpose, is to get out there and educate not only my fellow colleagues but the general public. That's why I've written a book. That's why we use that book with patients to explain. That's why we're putting things on social media, which is a very powerful teaching tool and exposing people to a lot of this information. I do the best I can do with those we have the opportunity to serve and take care of in our office. Well, one of the reasons I find that patients don't come back to us after they have a denture is their perception is their oral health problem's over. because they don't have teeth.
So they don't go to the dentist anymore.
They don't go to the dentist. But the truth of the matter is, dentures are not the solution. At that point, they're going to become part of the problem because the bone underneath the denture is going to go away because bone needs to be stimulated. That's why we want older adults to work out and exercise and walk. The bones are maintained by putting stress on them. But that's not how teeth work. When you have teeth that rest on the bone, it makes the bone wither away. And when the bone withers away, the face changes, the ability to chew.
So the dentures don't know their options?
No.
About dental implants?
No, because I think their option being presented at that time is get out of pain and suffering. And I think that's a reasonable option. But we as dentists need to educate the patient that there's always good, better, best options past wearing a denture that would involve dental implants, which would prevent all the things I just said.
Now, also we should mention, I mean, you're the first periodontist, I guess, trained in dental implants. Is that right?
That's right, 1986. I can't believe it's that long ago, but it was 1986.
You know, I joked to one of my staff, and you were in the other room, I didn't know you heard me, I said, this guy's been around dental implants since they crawled out of the ocean. You said, I pretty much have. So you've been there at the beginning?
Yes, I didn't come to the party lately.
You've done thousands and thousands of cases?
Numerous. We'll put it at a numerous number of patients, thousands, I'm sure.
All right.
And Randy, here's the statement that they all make. If I'd have known it was going to be this easy, I would have done it sooner. If I known,
they really say that?
They say that. It's common. Or if I'd have known it had been this good or it was going to be a piece of cake, I would have done it sooner.
One of the things that separates you, and people need to know if they're tuning in, this is a real interview, okay? Nobody's reading a script here, and we didn't plan this ahead of time, even on the telephone, but you do something a little bit different. You use this guided surgery on some of the patients. Tell me about that, and why is that a big benefit? And what do people need to know about that?
Well, it's a big benefit because, one, we have the technology. We didn't have the technology when I started in 1986.
Okay.
But today, with the advent of computers, and we have our own CAT scan machine in our office, we can actually take pictures of the patient, put it on a computer, and we can plan the surgery in advance. And when I lecture to dentists, I say the purpose of that is to avoid surgical voyeurism. And the dentist
what does that mean? Yeah,
the dentist kind of looks at me and says, what does that mean? Well, if I go to the doctor and the doctor has to say this to me, I'm going to open you up and find out what's going on. Even as a doctor, I'm a little nervous about that. I'm thinking, he's got to open me up to find out what's going on. Well, don't you have a CAT scan? Don't you have a computer or something to let you know what's inside of me before you make an incision? Well, that's exactly what we can do with implant dentistry today. When we use this computer-guided simulator, we can actually sit with the patient if they want and do the surgery on the computer. And I can tell the patient, look, we don't have any issues. We don't need bone grafting, which nobody wants. We can do it in a very short period of time, and we can have a result that requires...
So you have guides. I mean, you have guides that come back.
Yes.
That make the procedure very precise.
Precise within a half a millimeter, that precise.
Okay.
The surgeries, my average surgery, let's say for somebody who has to have their teeth taken out and put implants, an hour. This patient, 20 minutes. So nobody wants to be in the dental chair any longer than they have to. You have other things you want to do in your life.
So less trauma to the gums.
Oh, absolutely.
With these guides.
Much less trauma to the gums.
That's why there's less pain?
We've had patients, less pain, go to work the same day.
Really?
I mean, 8 o'clock procedure, go to work with all of their teeth.
Should they look for a doctor, a dentist that's going to be doing a guided? I mean, what do you ask? Do you say, do you do guided? Do you use the computer to plan? I mean, what do you say? What's the term? What does a patient need to ask of their doctor,
well, I think
in your opinion?
I think what they need to ask is, do you give the patient all the options that are available today with all the technology? I mean, there are some centers, they only offer one style of doing surgery. Generally, it's incisions. You're going to be there all day. It takes longer. Whereas with this technology today, you don't have to do that. If we say to the patient, would it be interesting to you if we could do it without having to sit in the office all day? You could maybe go to work. You're going to have your teeth when you leave.
Well, everybody wants that, obviously, right?
I find when consumers are presented with that option, not that the other centers don't offer good options, but there is a better option.
California, we've done research here, that there's a lot of chain dental implant centers. You have them in St. Louis, you say.
Yes, we do.
Are they using this guided type of computer technology?
Fortunately, unfortunately for some consumers, they haven't grasped this technology like we have.
Okay.
And I was one of the early adopters. I've been doing this for 6 years.
Well, why? Why would if it's as good as you say it is, again, why aren't all the doctors using guides?
Well, first of all, I find it takes a grasp with technology. You have to be able to operate a computer, to understand the technology. And you know, Randy, I'm not, as I said before, I've been doing this a while. I'm not the youngest doctor, but I'm also not I'm very technologically involved as a doctor. So I have a good working understanding of computers and how to use computers. We use computer technology.
So you're pre-planning the surgery right on the computer?
With the patient, if they want, in real time. They get to see what we do. This is the art of dentistry, and I know you have some of the top leading dentists in cosmetic dentistry on your show. And one of the things that we can do today with dentistry, with the digital technology, is we can do exactly that. We can show you, this is your face, this is what it's going to look like with these teeth, this color, this shape of your teeth. Absolutely.
When it's all done, okay, so you take a denture where you give them a fixed set of teeth in their mouth with just 4 implants in some cases.
Yep.
What do they tell you? I mean, what improvements? Maybe what happens that they didn't anticipate when it's all done?
Well,
what do they tell you?
The first improvement is eating. And we all want to eat. We just had a great lunch, and we were talking about the ability to eat food.
Yeah, but you were talking about dental implants the whole time, so I've had better lunches. Right?
but the truth is, I think a lot of patients, it's just the physical enjoyment of eating.
Okay.
I remember a patient, we did this immediate load, and we have very specific instructions.
Immediate load just means teeth that same day.
Teeth that same day.
Okay.
He's a burly, big, heavy-set gentleman from the middle of Missouri, and he's got he's a farmer, cow, and raises cattle, and he lost his upper teeth. We took him out, we put in the implants, and gave him an immediate denture. And he went home, and we give him special instructions. They need to be on a soft diet, and watch certain things. These are not for ripping and tearing food, but his teeth were really bad. He couldn't eat with his existing teeth. So the next week he came back, and he's looking at my assistant, and I'm in the next room. I'm not talking to him, but I'm hearing him talk, and my assistant says, "Well, how'd you do, Bill?" He says, "Oh, these teeth are great." He said, "I had a steak for the first time in years." Well, I'm in the next room. I shuddered. They're not supposed to be eating steak. So I came in the room and I said, "Bill, how are your new teeth?" And he kind of said, "Oh, they're great, Doc. They're so much better than my old teeth. I had a steak." I said, Bill, we got to remind you, they're not ready. You need to kind of jog, walk, and run here, and we're in the jogging phase of this treatment. So I'm not going to encourage you to eat steak, but I will promise you, at the end of this, you'll eat steak." And they do. They eat foods they couldn't taste.
You say they become more social. Is it just because now they're going out to eat with their friends?
Randy, that's one of the shocking things that I see. Sometimes a wife will bring a husband in, or a husband will bring a wife in, and it's not about the implants, it's not about eating. Their social life has been ruined by the fact that one of them's wearing a denture. They're self-conscious, they can't eat, they don't want to go out and be with their friends, and so really they become shut-ins. They've been social shut-ins. And they're seeking that as a solution, dental implants as a solution, to avoid this change in their lifestyle. And once we give the spouse the implants, they're back out dancing and they're back out socializing with their friends.
Okay, so just because they have teeth.
It's not about the implants. It's about the benefit that the implants afford to the patient.
Okay, we're going to take a quick break. We come back more about. I want you to take me through the process, but also you have a page or a chapter in your book about good, I think it's good, better, best options for the denture wear. You're watching The Wellness Hour. We're talking about dental implants. Who's a candidate? We'll be right back.
I had very little discomfort. I was amazed. I went home. I felt fine, and I was very pleased with it.
Well, it's just probably the best thing I ever did.
It's very simple. I mean, it sounds scary, but it was very easy.
When we were going through the process, the bottom ones were in, and I had a denture at first up on top, and it wouldn't stay. It fell and wouldn't, and I'd go without having it in my mouth. But having all these in, these are in good, and they don't come out, and you can chew whatever you want to chew, and I'm not embarrassed anymore to smile, and I'm happy. I'm absolutely happy with it.
I told my husband when I left here, it was a piece of cake.
It wasn't very painful. I thought it would be worse, but Tylenol helped, and that was it, just for a day. So very easy. I would recommend it.
I was having real trouble, chewing food, and now there's just no issue at all. I can eat anything and feel very comfortable, biting into an apple. It's terrific. So it's much improved.
Steak. Tonight's steak.
Well, I expected the best, and that's what I got.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are here with the author of Change Your Smile, Change Your Life. We're talking about no more dentures. According to Dr. Duello, you can get a fixed set of teeth with just 4 dental implants, a full lower arch of teeth. Is that correct?
That's correct.
And they don't have to come in and out. And in some cases, you could do them right there in one day.
That is absolutely correct.
So that's not an exaggeration.
That's not an exaggeration. We do it on a weekly basis, a daily basis. And Randy, I think, we've talked about different options, and when patients are faced with this, the cost is always an issue. You have to take that into consideration. And for some people, if we present good, better, best options, my goal is to always present them an option that's upgradable.
Okay, so denture, if they weren't here before the break, chapter in your book, for denture wearers, good, better, best. What does that mean? Elaborate on that.
Well, first of all, let's talk about what implants do.
Okay.
An implant preserves bone. I'm a bone specialist. I have a master's degree in oral biology. So I want to preserve bone. And we know that once the implant's in place, it preserves bone. So that's number one goal. By preserving bone, we improve chewing, we maintain the facial structure, you don't prematurely age.
Okay.
With just 2 implants in the lower. So some people, that's all they need.
So 2 implants gives them a snap in, snap out.
It's a denture that's removable. It's not fixed in the mouth.
But is it much better than even the best denture out there?
It's better than the best denture out there.
Okay.
I consider it to be the standard of care, minimally.
Okay.
Is 2 implants.
So that's your good. That's your good option.
That's my good option.
2
now,
implants.
The better and best option, we start moving to things that are not removable. The patient who I find likes the removable option is maybe somebody has been wearing a denture for a long time. They like to take it out. They like the ability to clean it. I'm not saying that's a bad thing.
Okay.
And they put it back in, and they're happy. They're very happy. I have testimonies of those patients who are saying they're thrilled. It's better than what they had before. Their life's improved. Just 2 implants. My goal is to have somebody whose teeth stay in their mouth like teeth. They act like teeth. You brush them like teeth. You chew with them like teeth. You smile like teeth. That's the fixed option. That's something that's only removable by me, not removable by you.
Okay, and they can really do it with just 4 implants.
In the upper jaw and the lower jaw.
Now, what if somebody, and I told you this before, because, and I'm trying to, I'm trying not to side with you. I'm not endorsing you on this program, but a 75-year-old woman, my mother, says her medical doctor says, probably too old at 75 for dental implants, okay? I mean, you're saying that that's just not the case.
No. When I first interview a patient, we talk, I tell them there's 2 criteria. You have to have enough bone, and you have to be able to walk into the office.
Okay, but at 75 years old, and she's been in dentures since she was 35. Didn't she lose so much bone that she's not a candidate?
Fortunately, they don't. That's the good news.
Okay.
They don't. And that's why we have the technology to quickly assess, do you have enough bone? That's the first question I said we have to answer. The second question is look at their medical history.
Is it very rare, by the way, that you meet people that don't have enough bone?
It's not rare. But it's also not uncommon. But the good news is we do have things that'll help those patients because I'm an advanced treatment center. I have advanced techniques beyond doing 4 implants with computer-guided surgery.
So you could do 6 implants or whatever.
We do what's necessary based on the patient.
So most people are candidates one way or another to get a fixed set of teeth back in their mouth.
In my opinion,
right?
yes.
Interesting.
Yes.
Okay, so good is, in your book, 2 implants, snap in, snap out. Better is maybe 4 implants. Mm-hmm. And I'll let you finish here. I'm sorry.
Yeah, it's all right. 4 implants works fine on the upper and the lower, but there are patients, let me give you the analogy of the farmer in Missouri. People chew different ways. Some people chew like a bird, and some people chew like a cow, side to side. Well, if you don't put if you don't put enough implants in somebody who chews side to side, they might weaken the implants and weaken the bone and lose their implants. So for that patient, we have to do a different procedure, maybe the better procedure, because we're under engineering what their chewing is. Everybody has a certain way they chew. Now, if you're a bird chewer, you don't need as many implants. You don't chew as hard.
I've never heard this before.
Yeah.
Bird chewer, a cow chewer.
Yeah, I mean, Randy, when when I went to high school, people said, he looks smart, but he talks like a simple person. And I figure if you can't understand what I'm saying, you're not going to understand anything else I'm saying. Okay, so I try to couch these things in very simple terms. But the truth is people do have different patterns of chewing. And we tailor our treatment to the needs of the patient, not only what they want to do and what their goals and benefits are, but what my teaching, my history as doing this for a long period of time have taught me is what is going to work.
Now, I don't ask this, by the way, on any of my shows because I think it's too self-serving, et cetera. But when I meet people that are really good, whether it's a heart surgeon or whatever, secretly they think like they're one of the best of the best. Do you feel that way about yourself? Like you're at the top of your game?
Randy, I gave a lecture this morning. You know this. I was up the highway and gave a lecture to the largest implant company in the world. And what I find is I'm learning every day.
Okay.
I do feel like I'm on top of the game. But the truth is, somebody will come out with some new information that I need to capture and understand. And if it provides a benefit to my patients, I'm going to keep learning. I'm a lifetime learner. I look forward to the new challenges.
So the turnaround, and we are out of time, by the way, but the turnaround time, a denture wearer, if in a perfect world, okay, in their 70s, and maybe they're even skeptical, but if everything goes right, they go to your office, what's the turnaround time where they could have a fixed set of teeth in their mouth, eating and chewing?
I think in a perfect situation, 2 weeks at the most.
Really? Wow.
If they have a good denture, they're healthy, we don't have any medical issues that we need to iron out before we start, we can probably schedule them within 2 weeks.
Could they have a little bit of osteoporosis and still qualify?
Osteoporosis is not a contraindication.
Really?
It's a consideration, but not a contraindication. And if you think about it, making the bone more dense with dental implants would help the osteoporosis. So we do need to be careful and look at their medications and their history, but it's not a contraindication.
And it doesn't hurt. I mean, pain is not an issue
Randy,
with this.
Here's how I tell a patient: if you're having pain, I'm not doing my job. If you're having pain, I'm not doing my job. My job is to make sure during the procedure you feel nothing. If you want to be relaxed in some manner, we can do that. We have anesthesiologists that come in and do that, but the majority of patients don't. The majority of patients do it with local, maybe some light sedation. I prescribe medications afterwards. But the truth is, Randy, you've seen the videos one after another that we reviewed before this program. They don't have much discomfort. And that's
so don't let fear keep you from getting this done.
They all say that don't waste a good worry over this procedure after they're done. It wasn't worth the worry. They ought to worry more about what they're going to get for dinner now that they got their good teeth.
So make the call, get started, go in for at least a consult to know your options.
Right, and again, I think one of the options that we offer that thrills me is this new technology with using computers and guided surgery. I think that is where...
Ask the doctor you're going to, do you have guided surgery available?
Right.
And can they say that?
Yes, absolutely.
Do you have guided... Very interesting.
Right, and do you do more than one type of way to do it? Do you offer patient options, or you only do it one way?
So all on four is what we're talking about with you. 4 implants to give them a fixed set of teeth.
Right.
Okay.
Absolutely.
I want to thank you so much for coming on. Great stuff. Great book. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com or go to Dr. Duello's website. You could follow Dr. Duello on Facebook, on Twitter. He's all over the place. He has his own YouTube channel filled with patient testimonials. So, again, thanks a lot.
Thanks, Randy.
For now, I wish you good health.